Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is how to non-operatively treat sciatica. First of all, what exactly is sciatica? Well, sciatica is pain that occurs in a person's leg due to a pinched nerve, and it's typically from a herniated disc. You can see here this view of the sciatic nerve from the front. You have the L4 nerve root, L5, and S1, and they come together to form the sciatic nerve, and after it leaves the pelvis, the sciatic nerve runs down the back of the leg. So if one of those nerve roots gets pinched as it's leaving the spine, then a person can experience sciatica pain. At any one point in time, 1% of Americans are suffering from sciatica. And what exactly are those symptoms? The symptoms depend on which nerve root is being pinched, and most commonly it's a herniated disc between one of the two bottom levels, L4, L5, or L5, S1. And the nerve being pinched, as you can see here, here's a herniated disc pushing back against a nerve root. That in and of itself does not cause pain, okay? It's actually the inflammation that gets sparked up that leads to sciatica pain going down that nerve root. And it can be burning, searing, electrical type in nature. It can cause tingling or pins and needles sensation, along with cramping, aching, numbness, and muscle weakness. Well, how exactly is sciatica diagnosed? Initially, it's history and physical. What the patient says as far as where the pain is and what it feels like can be very indicative that that's what you're dealing with is sciatica. On physical exam, one of the best tests this doctor is performing here is a straight leg raise test. That puts tension on the sciatic nerve and causes severe pain. And when the knee gets bent, that's when the pain goes away or relaxes. And when an MRI is performed, here's kind of what you can see looking down on the disc. Here's the disc itself. There's a large disc herniation, this piece pushing back against the spinal cord and this nerve root that's trying to get out. Okay? So MRI can be very helpful for showing a herniated disc. And if a person has sciatica and an MRI is not showing the problem, then a nerve conduction study can help with figuring out where the pain's coming from. Well, here's something called the dermatomes. And this is if a patient walks right out of a textbook, which they usually don't, but L1 supplies sensation up high, and then as you move down the leg, L3 goes past the knee, that's where the sensation comes from. L4 goes on the inside of the calf, and then here you have L5. So if someone has an L4, L5 disc herniation, that usually pinches the L5 nerve root, and they'll often get numbness and pain and tingling on the top of their foot. Okay? And here's a chart showing what happens with muscle weakness. So it's more concerning than just numbness because it's unclear if you watch muscle weakness how long before it becomes irreversible. We just don't know. So for instance, trying to extend your knee, that involves L3 and L4. Picking up your foot, which is ankle dorsiflexion, that's L4 and L5. So, and then everting your ankle, which is, rolling it out, is L5 and S1. So these are the motor tests that the doctor will do, and if there's weakness there, he or she can tell what might be affected. Now here's the non-operative treatments for sciatica. For mild to moderate pain, over-the-counter medications such as anti-inflammatories and Tylenol can be very effective. A Medrol dose pack can be prescribed, which is a 5-day course of prednisone. It involves a large dose up front, and then you taper off. It can be very effective for decreasing inflammation, but it's by mouth and it goes systemic, so there might be other side effects. So those should be used sparingly, probably once every few years. Narcotic medication can be very helpful, along with muscle relaxers, such as Valium. Neuropathic medications such as Neurontin and Lyrica can be very helpful for the sciatica pain, and topical pain medications can be great if there's back pain or focal pain. You can use lidocaine patches or anti-inflammatory gels or creams. Physical therapy and chiropractic treatment can also be great. It can help strengthen up the areas around the spine, take pressure off of those nerve roots. This picture shows spinal decompression therapy, which involves intermittent spinal traction, and it can help open up the vertebral disc areas and decompress nerve roots for months at a time. Interventional treatments are great. There's trigger point injections, which are superficial injections over areas of aching and cramping and spasms. That can be very effective. There are different types of epidural injections. Here you see what's called a transforaminal one, where the pain doctor will insert a needle into the area right where the nerve root is getting pinched by this herniated disc, okay? And it bathes the area with soothing steroid medication, anti-inflammation, that can cause pain relief. It does not cure the problem. It's not going to make this disc herniation go away, but it can soothe the pain for weeks to months at a time to allow the body to disintegrate this piece of disc because it knows it's not supposed to be there. So it's a proverbial Band-Aid, and studies show that it's 75 to 90% effective at pain relief. You may need a series of injections, 1 to 3, over a 6-week period, which can then be repeated every few months. Well, what are the outcomes with non-operative treatment for sciatica? Studies show that 80% of patients recover within 6 weeks. 90% recover within 6 months. And there was a landmark study years ago that showed that at the 1-year point, those patients who had either surgical treatment for a disc herniation or non-operative treatment had the same outcomes at 1 year. So it didn't matter. Symptoms to watch for, if there's muscle weakness, that is concerning, as we mentioned before, but if it's worsening, like if you have a foot drop and it's getting much worse, that is concern as well. And if a patient has incontinence, that's a surgical emergency, and it happens very rarely. The Nevada Pain Network has the best pain management doctors in the greater Las Vegas area, offering medical and interventional treatments, chiropractic, acupuncture, spinal decompression, physical therapy. So comprehensive treatments. There are several locations accepting over 50 insurances. The doctors are board certified. They've won the Patient's Choice Award 5 years in a row, which is amazing. And the number to call for treatment is 702-323-0553. And the website is nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops here.